especially in this world of social media, where we tend to post pictures where everyone looks perfect. It becomes all the more devastating. And somehow when we have something that's just less than perfect, we can really be traumatized by it. So this is very important for people who themselves, for the patient themselves. If you are the parent of a child with a skin disease, you need to be sure not to really sort of transfer that emotional feeling that you have, the sadness that you feel. Remember that expression, these things are only skin deep, and we really need to almost talk to ourselves about it. I think it's important to find a physician who is very sympathetic to you. Sometimes it's a matter of the problem that you have may be small compared to people that we're treating with melanoma, for instance. But to you and to anyone who has a facial skin problem, this can be truly a devastating period of your life.
Right. And even something I remember you told me once that stood out to me is being in South Florida, the different pressures we feel to like look a certain way. And obviously what's specific to, I think, to South Florida is when you're looking for a dermatologist, there's so many who don't take insurance, don't see medical patients, or are focused on cosmetology, right?
Yes.
And more,
yes.
and more
yes.
stuff
yes.
like that.
Yes. So I think there's a few things in what you mentioned. The standard for beauty and appearance is held extremely high in South Florida, often unrealistically high, especially for women from their teens till about the age of 40. So for instance, we're seeing young girls who are coming in at the age of 20 asking for Botox. So you've got to really sort of step back and look at this in a more realistic way. We are not meant to all look like supermodels. The other part of it is access to good medical care. And frankly, there are many physicians where there's more of a priority on treating, using procedures, putting in botulinum toxin, fillers, lasering people, and the medical aspect of dermatology is sometimes a little more difficult to have addressed by your doctor. And you really need, as a patient, to emphasize that you are really suffering from a skin disease, and the attention needs to be focused on curing that disease or treating it well.
And just based off your experience, for people out there who may be watching this and are dealing with something that may be more serious or something even minor, like, there's a lot of people, not just women, but men too, who, if they have a breakout, even if it's considered minor and even if it's on their back or whatever, like I had men message me saying they didn't want to go swimming because they were embarrassed about their back acne, and obviously women who don't want to leave the house if they have a breakout. So for people watching who feel like, they're diminishing kind of their emotions, or they feel guilty for being so upset, like what do you say to them as a doctor?
First, my message is to try to find a compassionate physician. Many times I see patients who've been to other physicians and they explain that maybe they kept on returning to a doctor where they didn't feel that the doctor really understood the full impact of their problem. Don't settle for less than compassion for your problem. The next thing is be vocal. Don't keep it to yourself. Find some kind of a support system, whether it's loved ones, going sometimes online can be a help in group chats and things like this. And sometimes a primary physician, a good family doctor, is sometimes even more supportive and helpful than the dermatologists themselves.
Yeah, I can believe that. And then last thing, I guess my question for you is when it comes to like the emotional aspect and the power of like positive thinking, and I think with especially skin conditions or anything that's like a visible medical condition, it's not just physically tolling or medically tolling, but it's emotionally and psychologically tolling. In your experience, coming from a doctor, I mean, do you believe in like the power of like positive thinking, or like
Yes.
Not being stressed, or,
Yes.
or feeling beautiful or feeling confident?
Yes, absolutely. This is my 40th year as a dermatologist, and one of the things that I so stress to everyone is that there's a huge emotional impact to how we perceive ourselves. Stress is a very big factor. The more stressed out we are by our appearance, the more delayed our clearing will be. First simple thing I recommend to everyone is go to the mirror smiling. They've been shown in many psychological studies that if you smile at yourself, you not only feel better, but you're perceived as more attractive. The other thing is throw out the magnifying mirror. That really shows us an image of ourselves that is not realistic. And then talk to yourself. I totally believe in the power of positive thinking. I have seen people who have had a whole range, a spectrum of skin disease clear, from psoriasis to eczema to acne, when they were able to really focus more on the positive aspects of their life.
Perfect. Thank you. Anything else you wanted to add?
Yeah, I have to say, and this is somewhat emotional, that I consider Frances Wang a hero in our community. So many people only post on Instagram about how perfect they are, how beautiful they are, how perfect their life is. And her sharing the reality of life, her sharing her own challenges, is going to go a very far way. And I want to thank the Miami Herald and other outlets who shared her story, because every week I'm seeing new patients who tell me, I read about that anchor and I feel so inspired. I don't feel alone anymore. Thank you, Frances.